One of the things that I like about ARA very much is that this is truly a microcosm of what's happening in the rest of rheumatology. And the physicians here are open to new. They are willing to innovate, they're willing to make the next step for the patients.
A clinical research trial is a study of the medication, and we study the safety and the benefits of the drug. That helps us to know what drugs should go to the marketplaces and which drugs are effective. It's very important for safety reasons for us to better understand these medications and how they'll affect our patients.
The clinical trials department has been very involved with really the vast majority of the big breakthroughs that have happened in rheumatology and rheumatology and medicine in the last 20 to 30 years.
Participating in a clinical trial gives patients an opportunity to have access to new drugs, and also our doctors, because they do clinical trials, they have an understanding of the safety and the benefits to each subject. It's great because otherwise these drugs are being studied somewhere else and our doctors have to learn about it secondhand or through papers. So it's good because patients have access to care, it's no charge to them, and our doctors are on the forefront of innovative new drugs.
Any clinical trial has a benefit of providing a new therapy that a patient might not have seen, or a mechanism of action that that patient may not have had a chance to experience in the course of trying to manage their illness. So that's the major benefit. Whenever we change the immune system, we take on certain risks.
There's always a risk when you try any medicine because you just don't know how you're going to react to it. And we monitor those patients very closely. The physicians here monitor them. They're still part of our practice and they're being treated by the physicians here.
The subjects really enjoy being involved with the coordinators, and thankfully the overwhelming majority of people that we work with in clinical trials gain benefit and give back to the world.
After having a variety of different treatment options that I have been utilizing over the past years, has reached a point where I was not getting any relief. So the opportunity presented that there was a clinical trial that I might be eligible for. So there was a little bit of apprehension, but I will have to say far, far more hope that this might be an answer for some relief for me.
If a patient wants to find out more information about our clinical research division, the Center for Rheumatology and Bone Research, they can go to washingtonbone.com, and it will give you a link to send a message to us, and we'll reach out to you and answer any questions you have as it relates to clinical trials. So sometimes we get family members or church members referring patients, so we try and make it as easy as we can. We know that, sometimes it's hard to spell arthritis, so we have washingtonbone.com.